Today I will be explaining the accuracy of our new test that diagnoses pompomonium. Pompomonium is a very rare virus that spreads through body fluids. The main symptom is patients physically exert themselves to the point of exhaustion. Other symptoms include irritability and body dysmorphia. The infected individual will eventually die from dehydration or malnutrition. A new test has been developed to diagnose pompomonium. The Braun-Cameron test has been developed to combat this new disease using intravenous dyes. To evaluate the effectiveness of the Braun-Cameron test, we used 10,000 people comparing our test along with standard pompomonium testing. We found that there were 1,274 true positives, 7,243 false positives, 126 false negatives, and 1,357 true negatives. The sensitivity of the test is 91%. We found that 91% of people that were tested positive for pompomonium were in fact positive for the disease. The specificity of the Braun-Cameron test was 15.78%. This is the rate of false positives, or the amount of uninfected individuals that received positive results. The high sensitivity and low specificity of this test means that most infected individuals will be detected, but a lot of uninfected individuals will have a positive result as well. Positive predictive value is the probability that a person with a positive test actually has the disease. We calculated that there was a positive predictive value of 14.96. The negative predictive value is the probability that a negative test means that the patient does not have disease. We calculated that the negative predictive value is 91.5%. The two predictive values show that if you get a positive result, you will probably have a false positive. If you get a negative result, you are probably not infected. These results suggest that this test can be used to rule out disease with some certainty, but a positive result is not reliable. Using this data, we found that the accuracy of the test was 26.3%. This means that roughly 1 in 4 people will be correctly diagnosed. Pompomonium is a rare disease, meaning that a high sensitivity and low specificity are not uncommon results. The disease is very uncommon within the population, which has an effect on the accuracy of the test. Because of these results, this test can be used for screening purposes only. It is not suitable for confirming the presence of disease. If a patient receives a positive result, you must explain that there is still a good chance that they do not have pompomonium. Positive results require further testing. If a patient receives a negative test result, you can express confidence in the result. Further testing is only needed if the medical staff deem it necessary. Thank you for watching.